Hello everyone, my name is Ariana Sian, and today I will be presenting to you my case study which disseminates pain evaluation and communication techniques for treatment of dementia. My practicum took place in Powell River, BC. In Powell River, older adults over the age of 65 comprise approximately 22% of the population. Willingdon Creek Village thus houses about 2% of that population within its 102 beds. During my practicum, I found that Willingdon Creek Village has many values which align with the School of Public Health and Social Policy's core competencies. As noted here, Willingdon Creek Village is affiliated with the Eden Alternative, an approach which gives precedent to maintaining determinants of health that particularly affect elders, like social and emotional wellness. My case study fit in with these ideals by providing partnerships with residents, families, and care providers alike. At the same time, the core value of critical analysis was crucial to my task in drafting an objective report for pain evaluation in dementia. Communicating with persons with dementia is complex. My purpose at Willingdon Creek Village was to address the inability of residents to self-report their persistent pain to their care providers, in turn offering a remedy to bridge that deficiency of communication. Care providers must be able to evaluate pain without any second guesses to the reports they hear. My case study thus crafted a report which offers a multivariate approach to pain evaluation and communication through objective and subjective research pathways. I want to take a moment to infer just why objective pain evaluation is necessary for dementia care planning, and why communication is an important aspect of that. As these statistics demonstrate, persons with dementia living in care homes are less likely to receive satisfactory care. As the ability to self-report diminishes, it is up to care providers to interpret it. Any mismatches in interprofessional communication can result in lopsided treatment. This shows that communication is crucial. Objective pain scales help to provide a mutual ground for all parties, the residents, families, and even the care providers. The task given to me by Willingdon Creek Village was to draft a report that would help care providers understand the residents with dementia and pain. I first began with the intent to blend life course theories into the research. This meant assessing the process of aging beyond the typical biomedical approach. My case therefore ended up recommending non-pharmacological solutions such as musical therapy and healing touches as pain management strategies. When I began to write my report, I wrote with a rational planning approach. Rational planning was useful for its linearity and predetermined goals. In order to maintain sight of these goals and the outcomes of the case, I drafted a logical model as support. And here is my logic model for my rational approach to the report. The majority of my report was written with the findings I derived from a standard literature review. However, I also gained knowledge from an informal group discussion, which I conducted with 5 experienced care providers from Willingdon Creek Village. Although I did not have enough time during my practicum to do a full qualitative analysis, I structured the interviews with a multitude of questions so that they would supplement whatever my literature review could not answer. I then carried out a pseudo-transcription of their answers to construct a beneficial narrative. Some of my report focused on effective communication via interprofessionalism. I mostly adapted theories on fostering a work culture of mutual respect and knowledge translation into my recommendations for the care providers. I'd like to share a brief excerpt of my report with you. This is just a sample of what I have learned about the factors of pain and dementia from both the literature review and the informal group discussion. Having completed my practicum case, I am excited to have my research influence dementia care and communication techniques at Willingdon Creek Village. Through this experience, I have gained confidence in my abilities. because of the knowledge I now have on dementia. However, I must make sure that my goals are not aimed too high. Nevertheless, I am glad to have had the School of Public Health and Social Policy teach me what I needed to know to get to this point here and now. Thank you.
Thank you very much. Are there any questions? Well, I have one. Did you have any contact with the families of the patients or the individuals within the...
Unfortunately, I didn't because I didn't have ethical clearance for that. But I did use a lot of the literature review, so a lot of the theories really advocated for education of the family members. So just telling them how dementia is going to affect their loved one and what to expect. And through that education, they are going to they're going to have a better partnership with the care plan that their loved one is going to receive.
Right.
Mm-hmm.
Ariana, this is just, you may know this already, but this is just for information because I'm just kind of interested in non-pharmacological ways to manage pain or distress or with older people with dementia. And there's a music therapy research project underway with faculty member in the School of Nursing here in a couple of care facilities here in Victoria. So I know that because someone that I know is actually partaking in the study. So that's just for information, and I think it's what you've done is very, very interesting. Thank you.
All right, thank you.
Good. Well, unless... Oh, yes. There we are. So I'm getting my afternoon exercise here. I like people who are a long way away.
My name's Inga, and I just had a quick question about the language that people use to describe pain. Did you come across any literature related to how people talk about that?
Yeah, I did actually. The Alzheimer's Society of Canada actually really advocates for a person-centered language. So really deviating away from that biomedical kind of primary care sort of language where you speak about the resident with dementia as if they're a task. Instead, you want to refer to them and with them as you advance along their care plan. So it's really like avoiding terms that just kind of encompass them as a product of the dementia. So it was really interesting to incorporate that into my recommendations for the care providers to just really be mindful of your patient and be aware that they are going to be part of the process for their own care plan.
Good. Well, thank you very much
for
this presentation.